Live, and today I have with me Dr. Priya Varshney, and Dr. Priya Varshney manages Dr. Priya's Fertility Solutions, and she specializes in fertility and IVF. She's working with Cloud9 Hospital, Gurgaon. Apart from that, she's a gold medalist and a merit holder. She has more than almost 14 years of experience and in gynecology, IVF and infertility. Her main areas of interests are high-risk pregnancy, recurrent implantation failure, recurrent IVF failure, surrogacy, poor reserve, male infertility, female infertility, whatnot, ma'am. So it's like
enough for it.
Like by a pregnant female during this COVID-19 pandemic. So I'm very sure you must be getting a lot of questions from your patients as well, and even I am getting a lot of questions from my patients as well, that what to do, how to manage this phase of pregnancy, during COVID-19. So first thing first, so what are the symptoms of COVID-19 viral infection, if you want to summarize that?
See, what we are going to do is that nowadays, initially we all know that COVID-19 is the pandemic which was there for the long time. Since December we are facing this, and the main symptoms which we all know are the fever and sore throat, cough, and respiratory difficulty. But with the coming scenario, like we have around more than 10 strain of coronavirus which is present at present in this pandemic, and nowadays majority of symptoms are asymptomatic also. Asymptomatic means that a patient might not having any symptom and she just acquire flu virus from anybody which she is in contact with. So first of all, it is just to mention that it is a normal flu virus. So we don't have to be scared about that so much, that what will it create and what will it do. So normal flu virus, like we have a next which we will have a flu infection, it is just like that. So anybody who is in contact with a person who is having this flu virus can acquire this virus by droplet infection or airborne. So now what we are getting is that asymptomatic infection. If people don't have any symptom, still they can acquire the virus in their respiratory tract.
So more than, I guess, 80% of people are carriers today, I guess.
Yes.
Alright, so another very important question. So are pregnant women more likely to get sick from COVID-19? So is there any increased susceptibility as far as pregnant females are concerned?
See, when we talk about COVID-19, I again told you that it is a normal flu virus. So in pregnancy, what we have is a decreased immunity. So the pregnant women are more prone to any of the infection, whatever is in the circulating in the environment. So you can say yes, if we compare about normal population, yes, pregnant women are a bit more susceptible to acquire this infection, but they are not. It's not been seen that they are becoming more serious or the disease is in a severe form in the pregnant women.
So if they are ever acquiring the infection also, but then there is the chances of getting a severe infection. So that's what.
Yes, there are no chances that the pregnant woman might get sick with this infection. But yes, that's why the role of coming is that social isolation and the distancing. That pregnant women, due to their decreased immunity, they can acquire flu infection more commonly. But it's not like that it will be in a severe form in those pregnant women.
So, how can pregnant women protect themselves during COVID-19? It's just that they have to sit at home, or they can do any other thing apart from like sitting at home and being in isolation? Anything else that they can do?
See, first is that it's whatever we are the main preventive measure which we have decided in this pandemic is only two mantras. Only two mantras. That is self-hygiene. Self-hygiene means like frequent hand washing, because the thing is that this viral infection is droplet borne, and in some percentage it has been seen to airborne also. So whenever a person carrying a virus in their throat, in their respiratory tract, when they cough and sneezes, then virus can just go away just only 2 feet. So not beyond that 2 feet. So if you are maintaining a proper distance, even though if you are coming to in contact with a person who is a carrier, you can protect yourself, number one. And number two, suppose if you have acquired the infection also, if you have just accidentally touched any surfaces or where you have the fomites and all, and you are doing the frequent hand washing and hand hygiene you are maintaining, then yes, you can be free from this infection. So yes, just 2 mantras, that is social distancing and frequent hand hygiene. Yes, and one more is the respiratory hygiene. Hygiene.
Very important.
Don't touch your mouth, face, and eyes frequently. See what happened. Just a common practical problem. You have just received the courier of vegetables. I'm just telling you about the common practical problem. It is containing some fomites, and when you are going to touch it or you just wash it, and you might have acquired it in your fingers, and accidentally you touch that fingers, your mouth and nose, and then it goes inside your respiratory tract. But within 20 minutes, if you wash your hands, if you did the sanitization of your hands, then you just drop it away. So it is just cleared off. So you are protected from that infection. So at present, in this era when the lockdown has opened up, we cannot isolate ourselves from the person who are not carrying the infection or who are carrying the infection. But yes, we can protect ourselves from this infection by doing type of these two mantras.
That's really great to know about the 2 mantras that you have shared with us. So another question, can a COVID-19 pregnant female deliver a baby with birth defects or any complications? So have you experienced any of the COVID-19 patient having delivering a baby with complication or birth defect?
We can say about the effect of COVID-19 is that what is the effect of COVID-19 on pregnancy? If we talk about the studies, what we have a literature is that around 1,000 plus women has been delivered with the COVID-19 infection. Even they were on ICU also, they were on serious mode, they were in ventilator also. Even one woman in US was on ventilator, and just for her respiratory distress they have delivered the baby, and after delivery she was completely okay. So till now they have not seen any pregnancy complications due to COVID-19. Like we don't have any increased risk of pregnancy complication, like it be a preterm labor, any birth defect, or any premature rupture of membrane, or any congenital anomalies in the baby. Till now, it has been not seen to be transmitted in utero, means through the baby to baby, or vertical transmission is not seen. The mother who were positive COVID-19, when those babies were being tested for COVID-19, they were absolutely negative.
So moreover, doctor, to add here, I think all the studies that have been performed till now, they are performed in the patient population who were in the 3rd trimester, because it is not a new virus. So I think if we talk about the birth defects, all the organ development starts from the very beginning of the pregnancy. So I think this is it's still into process, still into investigation, and still into research. If we talk about,
there are few studies which is coming up that it causes placental insufficiency, like it causes a stage of ischemia in the vessel. So it might cause placental insufficiency, and might be leading to miscarriages and missed abortion. So this is the new study where the evidence is not much, but the literature is coming up. So especially if a woman in the 1st trimester, they should be more protective for themselves.
Very true. For those who are planning a pregnancy right now, they should be more cautious about it. So I think they should be more cautious about it. Okay, so one very important question that I have got from pregnant females is, can any of my antenatal visits be virtual? Can I take a video consultation or a call? Can I talk to my doctor through a video consultation or through a call. Is that possible?
Yes, it is definitely possible. What ICMR and we, the Association of Gynecologists, we have decided that there are few visits which are essential for pregnant women, and there are few which can be absolutely omitted. So, if we talk about the essential visits, are around 4. One is at 12 weeks. One is at 24 weeks, one is at 28 weeks, you can say about, and one it is at third trimester, it's 36 weeks also. And these visits, yes, one time are essential. You can say in each trimester, one visit is important. Like first 3 months, next 3 months, and last 3 months. And rest of you can communicate with your doctor virtually also through e-consultations also. If your doctor feel like that it is necessary to visit you in person, then she will definitely call you for a personal visit.
And what about ultrasound? So are pregnancy ultrasound are they really very important to be conducted at the time, at the week duration they have to be conducted? So for example, an 18-week scan and a 19-week scan that we do. So are they really important to conduct at that time?
We can say about there are few scans which are essential for a pregnant woman. That is like this. We can say first trimester scan. That is when we detect the cardiac activity. Number 2 is our 12-week scan. That is known as genetic level 1 scan. Number 3 is you can say about level 2 scan. It is at 18 to 20 weeks. And number 4 is that fetal well-being scan, which we normally conduct at around 34 to 36 weeks. So yes, these 4 scans are must, and rest, if everything is okay and you are in the low risk, you can omit those scans.
So these are absolutely important scans. All these 4 scans are absolutely important. You should not omit if you are pregnant. So
yes,
so the relevance of doing the scan after few weeks later would diminish. So it is better to go for a scan at the designated time zone when it has to be done.
Oh.
All right, doctor. So another important question is can a pregnant female go out during the time of eclipse? So I am listening that there are a lot of eclipse coming now. So can pregnant female go out at the time of eclipse?
See, what happened during eclipse, it was initially the old thought was that there were some UV rays which are at time of eclipse, there are UV rays from the sun or moon which causes birth defects to the babies, that they were their role of on baby well-being was questioned. So if we talk about medically, there are no well-documented studies for that these UV rays or these rays are harmful for their well-being. And nowadays people are moving around with that. Just check it, because there are few times and when the rays are very strong or intense, or it is said about that few minutes or few hours, then you can look about if you're especially in first trimester. Then you can consider further things out. But rest, it is absolutely fine, not a worry about that.
Alright, doctor. That was actually a very informative piece of thing that you have shared with us. So, is it safe to deliver the baby in the hospital right now? So, are the hospitals a safe place? Because I'm very sure a lot of antenatal females must be worried about what it will be like. Will my baby be okay? Will I be okay when I go to the hospital? So how will the situation be? So is it okay to get a baby delivered in the hospital?
Yeah, perfectly. See, I'm getting too many queries, and the funniest query I got is that, ma'am, I'm scared of coming to hospital and I'm thinking of delivering the baby at home. So I thought, you can if you have a trained birth attendant or something trained like attendant, you can deliver at home. So see, what happened is that what everybody is stressed about, that whether we are getting a proper environment for delivery or not, are we at risk during delivery for delivery, the hospital environment is safe for us or baby. See, we have segregated our hospital area into 2 parts. 2 part means one part is that where we are delivering the patients who are not having any problem or any infection or nothing like that. And the second is that we are delivering patients who are having a suspected problem, having a suspected or doubtful result sort of thing. So we have segregated those areas and we are maintaining each and every safety precautions what we can. And there also we are following all the sanitization, hygiene procedure and everything whatever we are doing to the patients. Absolutely safe to deliver in the hospital. And yes, we all are prepared for the deliveries of suspected antibody also, and whatever it be, whatever type of delivery, we all are prepared for that.
So this is a very useful piece of information. I'm very sure a lot of antenatal females must be worried about their pregnancy, delivery, and one more important question: do they have to go for a COVID-19 testing before getting admitted to the hospital? Is it necessary to go for a COVID-19 testing?
See, there are every day the guidelines are changing. Initially, the ICMR has advised for a COVID-19 testing for all the antenatal patients who are delivering, just to check whether the risk of infection to the babies and for the other persons also. But nowadays, they are saying that you can we normally to protect the patients from getting infection also, and to protect the environment, to protect the premises, to protect the other patients also, we are getting COVID-19 testing before delivery. But your delivery process is not getting halted in view of the result. If you suppose reaching in the emergency and you don't have a COVID-19 testing now, then we are proceeding with the delivery as per the norms. That's it.
Alright, so if you reach to the emergency in just you are there 2 minutes prior to a delivery, then of course it would not be done. But then if it is a procedure that you get admitted to the hospital and you have 24 hours, so then you will be tested for COVID-19. That's a mandate, I guess, for right now. Alright, so another question. Okay, so is it okay for the visitors to visit the new baby in the hospital and when they reach home as well? So do you advise the visitors to visit to the new baby?
Before the first production only, we have told that we have to maintain two things, that is social distancing and hand hygiene. So what we can do is that we are not allowed attendant to accompany the patients. Only one attendant is allowed during the delivery time or during their hospital stay or during their delivery process. Many of them request that mother or mother-in-laws and they are wanting to visit. Absolutely no to bring senior citizens and kids to the hospitals. Just you have to have one attendant, preferably the husband, and if he is out of station or something like that, then you just call one of the relative. And just try to avoid frequent visiting for the baby, and baby should not be given in too many hands. Also, again, we have told you that at present there are too many asymptomatic carriers, so you don't know that who is carrying the infection. So you have to maintain the distance with the visitors and relatives.
Okay, thanks for sharing that. And another thing, so has the mode of delivery, whether the mode of delivery has changed, whether you prefer nowadays going for a cesarean section more and a normal delivery less? So has the mode of delivery changed by anyhow?
Not exactly. COVID-19 does not have any impact about the labor proceeding or the pregnancy outcomes. Whatever the mode of delivery will be determined by the obstetric status of the woman, not with the COVID-19 status.
That's absolutely, I think, a great.
It's like the women who are planning to deliver normally, so they will deliver normally. It's not about that if they are COVID positive, then we have to deliver it by cesarean sort of thing. No.
Very, very useful information that Dr. Priya to share. Okay, so can a COVID-19 pregnant female, if at all a pregnant female gets a COVID-19 infection, so can she breastfeed her baby? Can that be done?
Yes. So what we have guidelines for Indian Academy of Pediatric Society is that that COVID-19 virus is not transmitted in breast milk, so she can absolutely breastfeed the baby. The thing is that she has to express the breast milk. Like, she has to maintain the distance with the baby as far as the social distancing. She has to wear a mask properly when she is feeding her baby. And secondly is that she can express her milk and she can give it to a relative, and which they can feed the bottle feed, or the katori chammach feeding can be given to the baby for that. So it's not like that COVID-19 is transmitted in the breast milk and the mother cannot feed a baby for that.
So that can be done. That can be done.
Yes.
So breastfeeding
Yes.
can be done. So that's a big relief for the mothers. I think that would be a great relief for all of them, so they can breastfeed their baby. So in the meanwhile, I would like to tell all my listeners that we are live with Dr. Priya Varshney, and if you have any queries, you can ask him. You can write in the chat box, and please give some thumbs up or maybe some hearts to Dr. Priya Varshney, so that so show her some love. It would be really nice to send her some hearts and some love here. Okay, so another question. So does COVID-19 gets transmitted from the pregnant female? If a pregnant female gets COVID-19, so does it get transmitted to the baby, or the amniotic fluid, or the cord blood, to mention here the cord blood, the amniotic fluid, or maybe to the baby, if by any chance a pregnant female gets a COVID-19 infection? So does it get transmitted?
So nowadays what we are getting also the asymptomatic pregnant women who are also getting COVID positive status, because I told you that now it has gone to that asymptomatic phase. So when we talk about the COVID-19 status and the pregnancy, what happened is that it is a fat virus, so it cannot permeate the placental barrier. So that means that virus is not being able, in all the studies which has been done in the positive women, the virus is not able to be transmitted to the amniotic fluid, through the cord blood, or through the birth passage also. That is known as vertical transmission. That if the studies, if the study group have examined the baby, they have tested the amniotic fluid, they have tested the cord blood, they have tested the newborn baby throat swab, they have tested all the maternal blood, all the maternal vaginal swab test also. So it has not been found to see that the virus is being secreted in these secretions. So, but yes, lot of studies are still coming up. So we are, because it is new virus, so not everybody is aware of about the things out. Each day one new study is coming up. So we are still looking for its association with that, like how, whether it is being transmitted. There was one study where they have shown that when they have done the antibody test of the baby, then baby was having those antibodies positive. But it was explained that these antibodies were the protective antibodies which is coming from the mother, as because if the mother has a viral infection, her body start producing antibodies, and that is why we are following the role of that what we call the plasma therapy, which we are giving in COVID-19 patients treatment. So those antibodies do pass to the baby, and baby especially has a bit of protective effect as compared to that infective effect. So it's the mother who is protecting the baby, that's it, always.
So that's great to know that the baby is not getting the infection, it is not getting transmitted to the amniotic fluid, cord blood. So majorly studies that have been done, this has been shown that it has not been transmitted. And again, to the breast milk as well, as you mentioned, that it doesn't get transmitted to the breast milk as well. So good piece of information there. Alright, so another question, how to improve my immunity? So a pregnant female, they ask me as well a lot of times that how can I improve my immunity? So I think that's the only thing that we can do right now to improve our immunity. That's the only thing we have in our hands. So how can we manage that? How can we improve our immunity?
Yes, so this is the only thing you rightly said, Divya, that this is the only thing that we can do at present to protect our body against this viral infection, which is really barking our head for all the persons. So, exactly. So, see, we have to really concentrate on our diet. That is what we are taking. At present, I know that with all those lockdown and family, people are really in their homes and they are cooking left and right and they are eating perfectly things out. But we have to look about and give a thought that what we are eating. That are we eating more of carbs and fats only, or are we eating some healthy foods also? So if we talk about healthy foods, like we can say all those protein containing food. Protein is the builder of our body, so it helps us in fighting any infections also. Are we taking enough proteins in our diet? Proteins, if we talk about protein rich food, is you can say about all those dals, pulses and sprouts and you can say eggs also. So are we including all those proteins in our diet, and are we taking enough of vitamins and minerals? The most important source of vitamins and minerals are the fruits and vegetables. So are we taking enough those vitamins and minerals, because these are only the protector for any of the disease. Or if we take about some immunity boosters medicines, like immunity booster, we can say vitamin C. We can say about those herbs and spices. We can say tulsi is a very good body healer also. And what the Ayush things has come up with all those immunity protectors, like all those cinnamon, tulsi, and let's say turmeric. So these are the few foods that which we can add in our diet. Yeah. Yes, so we can add in our diet to protect our body for any infection, whatever it be. So this in this way we can make our body a good immune system, and so that we can protect our body for any of the infection for that.
So is it like true that if we drink hot water, the COVID-19 virus, if it is there in our throat, it will go into the stomach and it will die there? So is it true? Is it a fact or is it a myth?
No,
so I have been listening about this.
There are many myths. See, what happened is that the virus inhabits in the respiratory tract and pharynx, yes, and so that it enters into the lungs. So the main invader of the virus is the lungs only. So what happened when we any of the flu virus need a bit of cold temperature in the body to survive. So these warm things, whatever, and when we have sore throat and when we have a raw throat, our throat is raw and any infection can invade through that. Yes, so any cold thing or any chill thing can make the things more raw and
Worse, yeah.
and worse, and it will invade the infection, help the infection to invade more severely. But if we drink hot water or if we drink some lukewarm water, so it helps in healing of that raw surface, and hence the virus cannot invade more in a more fearful form or a severe form. That is the only logic behind it. But it's not like that if we drink warm water and it goes to the stomach. See, it means, yes, it has been said that alkaline foods are better, but it's not like that. That this is not the logic for that. Hot water is helpful, but it is not the one that this logic is not fitting for that.
So as I take my session, so what I like stress upon is that you should take milk, you should take coconut water. So that nariyal pani, I think it has some antiviral properties as well, antibacterial, antifungal properties as well. So I always stress upon taking nariyal pani, banana, almonds, and milk. So that is like my mantra. Just improve your immunity by having all these things. So the only thing that we can do is by consuming all these things, we can improve our immunity. That is it. We don't have any other thing to fight against coronavirus now.
As that age-old belief is that the milk with a raw turmeric is really having a very good healing power. So if you can, then try to include that thing in your diet. That is really a very good thing.
So all the pregnant females there, if you are listening, so add turmeric to your hot milk and you will get that extra power to fight against coronavirus. Alright, so a few more people who have joined joined in, please share some love to our very sweet Dr. Priya Varshney. So it would be really great to have some love and some like buttons here. And if you have any questions, please ask any query that you are having. Okay, we have a query here from Shruti. So Shruti is asking if one gets fever, so when to get the COVID-19 test done. So how will I get to know whether it is a normal fever or a normal cough or cold, or if it is a COVID-19? So how can we differentiate between the two? So is it necessary to visit to a gynecologist?
See, what Shruti, first thing is that don't worry about that. Not all the fever is COVID-19 fever. So what the protocol we're following is that if the fever is persisting for more than 3 days, or if it is associated with any other cough symptom also, or if you're having any other problems also, then it is advisable to get the COVID-19 testing. Otherwise, if you have mild low-grade fever, then you can omit this for 1 or 2 days. Just observe your health about that whether it's okay or not, you are improving or not. Your fever is not it's a low grade, and it is just you take a crocin tablet for that. But yes, if it is a high grade fever and your symptoms are not improving within 1 or 2 days, then yes, get a COVID-19 testing done. But not all fever are having a COVID-19 effect. That's it.
So not all fevers are COVID-19. So don't panic in that situation. So if it is just a common cough and cold, the symptoms are not like you're not feeling breathless. So I guess you should stay at home and drink some hot milk.
I won't say that don't wait till you have the breathlessness and all the things out. If you're having high grade fever, if you're having cough associated with it, yes, then get the testing done. But if you're just having mild sore throat and mild fever, then see, majority of the if it had been also, let it be, God forbid, if it had been a COVID-19 also and you're having only mild symptoms, then you just have to follow the rules of self-isolation only. Just it will go away by itself. So don't get panic about that about whatever I'm having COVID-19 symptoms, because majority of people have develop their immunity against that. So it will really get over once your body immune system is perfectly fine.
So self-isolation is the key, and maintaining distance, and then improving your immunity. I guess that's the key here. Alright, another important question here. How is exercise important during pregnancy? So do exercise, it has any role to play in improving the immunity?
You are the better judge for that. You are the better person to answer those questions. Yes, I do agree that being a doctor, that exercise is really a very important part in all the health related events. It makes the body muscles strong, and it helps our breathing capability also good. It makes the lung capacity good, and it helps us in especially in the pregnancy. It helps in strengthening our pelvic muscles floor. It helps us in preparing our body for delivery and labor. So this is absolutely important, and nowadays I'm also advising to all my pregnant women to get the home exercises done. They should follow the normal stretching routine, and rest you can better tell us that just throw some light then how is exercise is important and what small exercises they can do.
So basically
Soon we'll start a session also.
Yeah, we'll do that for sure. So basically what I am doing is I am taking online sessions for all my pregnant females, and we are doing a virtual session. And moreover, with the help of, because right now what's happening is there is a lot of stress and anxiety because of this lockdown. Everybody sitting at home. We are not able to go out, meet our parents, and we have so many cravings right now. So we are not able to go out, eat our chole bhature or eat our golgappes right now. So it's I think a very tough situation for all the pregnant female. Very sure they are not finding it really like a happy situation to be in. So with the help of exercise, I think the endorphins are released, so that are like mood elevators, and it is very important to elevate the mood right now. So with the help of exercise, we elevate the mood, and apart from that, we improve the strength, we improve the muscle endurance. And if you can't do anything, just go for walks. That's that's the first step that you can start with walking, and then connect with me. We'll do it together. We'll do all the stretches and strengthening exercises together.
Perfect. So that was a good, really piece of information, and I think there are few exercises which can be followed during first trimester, second trimester. There are specific exercises for all those trimester wise. So you are the better judge to take that how much, because in pregnancy first trimester we normally go for mild exercises, and walking is best, but at present people are not able to go outside to walk, so they can do mild stretching exercises. And especially in the third trimester they have to do their pelvic floor strengthening exercises, triggers exercises to strengthen their pelvic floor, and which can help them in their delivery process.
Thank you, Dr. Priya, for joining us today, and I think I have covered all the common questions that a pregnant female have asked around, and all the questions that have come up to me. So thank you for joining us, and we would like to meet again for our antenatal session, so that we are planning soon. So let's meet up again for doing an antenatal session together with our patients, with our antenatal females, of course.
It was really a great piece of information that if we can clear many of the doubts, because people are really stressed up at this time. I'm getting many calls. People are really stressed up. They are depressed. They are not because everybody don't know that what to do now, because it is really completely a new thing for everyone. So just from my side, don't worry. This will take over. It will take at least 1 or 2 months more, or maybe 3-4 months more. So we have to prepare ourselves how to live in this environment, how to protect ourselves from this environment, because we have to take over this thing as a few months more, or maybe few this year.
I know, a few months more, or maybe this whole year. Till the vaccine comes, I know. This is actually a difficult situation we are in, and till the vaccine comes, I think we have to be like this. And so, what about the IVF cycles? Have you started the IVF? Have you started the IVF cycles? Because
yes, about fertility treatment, we have restarted the fertility treatment.
That's great to know.
But with a great caution, because people are really stressed up. They want to get their cycle done immediately, because people are holding the cycle for such a long time.
The whole year is wasted for them, as in
exactly.
They are waiting for that thing.
And we have restarted the cycle slowly, and slowly what we are doing is that we are first screening the patients that whom to take first, because see, till when we will wait, that is the thing out. So we have come with some guidelines from our Indian Fertility Society and International Fertility Society, so we are trying to follow that guideline, and we are slowly coming up with all those fertility services, and you can follow. I'm really trying to make some e-health talk also on fertility related videos. So I'm really coming up with the next video on how to start your fertility services in this COVID pandemic. So for that I'm preparing the stuff, and I'm taking up the queries what all they have their mind. And to the biggest surprise, just before the session, I have got my first news of a patient. We have done just restarted IVF just after COVID-19, and she's positive.
Yeah, so yesterday only, I think you also shared this with me, that one of your patients, before starting the IVF cycle, she got a positive. So that's
we have just come up with a new surprises. Those who are struggling for the fertility for such a long time. So they are coming up with a spontaneous pregnancy, because they are now happy. They are now, with their family. They are getting time with their family. So the mind is diverted from other things. So the stress factor is very important.
For them, I think the lockdown period have had a positive effect. So they have benefited from this lockdown period. So that's a great news. Congratulations to your patient, and thank you so much for joining. Hope to see you soon for another session and sharing such informative things with us. Thank you so much, Dr. Priya.
Thank you, Divya.
Here
It was a
I am,
great
Dr. Divya,
session.
signing off.
So, just for other health-related videos, queries, do follow my Insta handle drpriyavarshne_IVF. My Facebook page is drpriyaIVF, and my YouTube channel on Dr. Priya Varshne. So, I'm trying to put all the health information, and I'm just putting all those blogs, those health related pieces of information about how to go with your fertility, how to go with your pregnancy treatment. So I'm just trying to help the society as much as I can. Thank you, Divya, for the nice
Please like and share Dr. Priya Varshne's page, and please follow her on YouTube, Instagram, and Facebook. And so that's Dr. Divya signing off from today's session. So it was a wonderful session by Dr. Priya, and thank you so much for joining in.
Okay, bye-bye.
Bye.